EMS is presented with a unique opportunity to see firsthand how our patients are living and managing their long-term medical issues. By providing our skill and knowledge to newly diagnosed diabetics, EMS can help reduce the strain on emergency rooms and, most importantly, improve the quality of life of our patient population. According to the 2016 Community Health Needs Assessment conducted in Monroe County, the rate of hospitalization for diabetic emergencies is higher here than elsewhere in the state. Prevention of chronic disease is listed as the fourth highest area of concern in Monroe County. While the overall numbers seem low at well under 1%, diabetes is known as the seventh leading cause of death worldwide per the World Health Organization. Completion of these home health evaluations and education of proper diabetes management includes addressing many other comorbidities, including hypertension and obesity. Current management of diabetes is handled mostly through a patient's primary care physician, as well as diabetic education courses. We know that this disease is more prevalent in minority and impoverished communities where these resources are already in limited supply. There is a bevy of available information through online resources such as the American Diabetes Association, but community outreach is typically targeted toward the disabled and elderly via programs like at-home nursing or those offered by Lifetime Assistance and Lifespan. This gap in availability is perfect for EMS to enter. Many patients understand the what, but there is difficulty in implementation of strategies due to outside factors such as stress, mental health, finances, racism, lack of time, lack of food, and lack of available transportation. Of note, food is already a large part of many cultures, making it even more difficult to change those habits. So it is of utmost importance to educate on routines to manage diabetes. For every new diagnosis, EMS can implement wellness follow-ups that include teaching the patient what to expect, what to do, and what resources are available, as well as healthy cooking and eating habits. This will empower the patient to take ownership of their medical conditions, and the connectivity will help them feel safer, less alone, and less threatened. Assisting them in their own environment will help reinforce the importance of a daily routine. Identification of this population can be completed through a thorough review of our current agency call volume, consultation with local hospitals, doctors' offices, and clinics, as well as reaching out to the community for potential participants. While paramedics are well versed in diabetic emergencies, additional training will be required to complete these at-home assessments. Resource management is priority number one when starting this program, as you don't want to compromise the prime directive of answering emergency calls. Benefits of such a program are widespread. They will decrease emergent diabetic calls, which in turn will reduce patients being brought to the hospital. This leads to patient empowerment, independence, and an overall improved quality of life. Insurance companies are also more likely to pay out for preventative care than emergency care, as it is cheaper. Plus, supplies for the project are limited. The biggest cost to EMS will be crew education, training, and resource management. The following is a short recap of many of the benefits of a community paramedic program.
I also provide services outside of 911 calls. For patients like Mr. Chen with an ongoing medical condition, I visit him in the hospital and help him follow through with his care instructions at home. I help him get the follow-up appointments he needs with his medical and home health providers so he doesn't end up back in the hospital. Paramedics are already highly trained to evaluate patients and manage life-threatening emergency situations. But with more flexible roles and some additional training, we can help treat patients more efficiently and at less cost outside the emergency department. Most importantly, we can make sure the people in our communities are getting the care they need and the care they want.
Thank you for taking the time to listen, and if you have any questions, feel free to ask.